Good morning, everyone. Welcome to the second day of the IMCAS Asias. And I'm Dr. Vichai Hongcharu from Thailand. It's my privilege to serve as both moderator and a speaker for today's symposiums. This morning, I will open the session with lectures. And I would like to invite all of our speakers to sit on the podium. First is Dr. Chang Li Lin, and also Dr. Nishigawa from Japan. This morning, I will open the session with a lecture on sequential pulsing radiofrequency for facial tightening, which I will follow by the presentation from Dr. Chang Li Lin and Dr. Nishigawa. After all three sessions, we will hold a Q&A sessions to address your questions and insight. Okay. I will talk about sequential pulsing radiofrequency for facial tightening. This is a device that from Genesis company, and the name of the device is density. The radiofrequency that used in this device is 6.78 megahertz, which is the monopolar and as a classic mode. And you can have mono and bipolar as a high tip mode. And the tips that come for this treatment can come for different sizes, for facial, for eye, for body. And it's come with the cooling system, and this will be used the cryogen glass that you can apply the cooling level into 5 levels. This is the panel of the device that you can see here. You can adjust the energy level at 0.5 increments to up from 0 to 8 levels. You can adjust cryogen spray level to cool the tips as well during the treatment. You can have different type of size of the tip to fit with the area of the treatment, and you can adjust as a classic like monopolar mode, or you can use mono plus bipolar that we call high tips. Since the monopolar 6.78 megahertz launched in the market 20 years, some 20 years ago, it's off-label, and now you might notice that there are many monopolar radiofrequency in the market right now. But you look at the density that the picture here shows the thermal diffusion profile. You can see that the density have ability to hold the temperature in the treated tissue for quite longer period of time after treatments, quite long enough that quite fit well to the conventional radiofrequency that launched earlier. If you look at the way that we heat the skin, the monopolar radiofrequency can divide into 5 pulses of each pulse 200 milliseconds, and for classic mode, we will use the monopolar for each pulses, and you can see that these 5 pulses will intercool with some spray cooling into the tips, and there are 5 cooling pulses based on 1 shot for the high tips. And for the high tip, the last pulse will be the bipolar. So you have 4 monopolar pulses, which will be 800 milliseconds, which is the sum up of 4 pulse of monopolar. And the last part will be 200 milliseconds of the bipolar, which is a unique approach and it's patent, and it's only device in the world right now that have this combination of 6.78 megahertz of monopolar plus bipolar at the same times. Why combine mono and bipolar radio frequency? You can see that in the earlier study, we have lots of study about monopolar, but this will be 800 milliseconds pre-treatment before the bipolar of 200 milliseconds come after, immediate after 800 milliseconds of monopolar. Monopolar and bipolar plus together give you the benefit of immediate and long-term treatment and selective treatment for shallow to deep layer of the skin. For the long-term improvement, you can get this long-term treatment from monopolar radiofrequency over 4 to 6 months and maximum 1 year. And because of these long-term effects that probably contributed by the volumetric heating of deep layer that will strengthen the retaining ligament and the septum in the subcutaneous tissue as well. That will reproduction of the collagen in reticular dermis. And immediate effect you can get from bipolar because this stimulation happen in the papilla dermis and some superior part of reticular dermis, and this will improve the fine wrinkle with the rapid collagen remodeling that will contribute to immediate effect within 1 month times. That's the advantage of the sequential heating. As we know that the only density that offer a patent sequential firing of mono and bipolar radiofrequency to properly treat the dermal regeneration, specifically the papillary dermis and reticular dermis at the same time. And the collagen field in the area of papillary dermis normally decrease from 70% at 40 years old to around 45% at 100 years old due to aging. But reticular dermis maintain stable during 40 to 60 years old, then decrease to 60% at 100 years old due to aging. So you can see that the monopolar radiofrequency, as I mentioned before, the heat will be going deep into the reticular dermis, and also if you go with 5 pulses, the heat will even go deeper, where that sometimes make a fat loss, and that's gonna create problem later on because of the sunken of the underlying tissues. Bipolar have benefit of the stimulation of the collagen elastin in papillary dermis. Combined together, you have benefit of the both bimodal radiofrequency. This is an animal model that has been shown in literature that the result of the immediate result after bipolar can continue improve within the first 30 days, and the long-term improvement of monopolar can be observed at 4 to 6 months and will last up to 12 months. This is something that we should know during the treatment of radiofrequency. The skin surface is often cool to protect the epidermis while allowing heat to penetrate deeper into the dermis and subcutaneous layer. This is create the reverse thermal gradients where the deeper layer of the skin are heated more than the surface. Why combine mono and bipolar in sequential way? This is the article that published in International Journal of the Molecular Science, that the study done in aging animal model is this mice, that we use the density energy level 2.5 with high tip and classic tip, mean monopolar and mono plus bipolar, and with the observation at 1 day and 28 days, with the evaluation factor of collagen fiber, elastin, and newly synthesized and mature collagen fiber. While sequential heating, you can see that the graph in the deep blue columns, you can see that the deep blue column here means mono and bipolar. And there's a mono and mono and mono bipolar and bipolar, mono and bi. You can see that the density improve the collagens by 76% over the baseline in one treatment. And when compared to monopolar, density improved collagen fiber by 52%. To closer look at the graph here, you can see that there's a control and mono and mono. Mono improve 50% and no mono and bi improve 76%. When you compare the difference between mono, bi, and mono, you can see that it improved about 52% or 0.5 times higher than mono alone. So then we come to a closer look at the elastin fiber treated by mono and bipolar compared to mono. Here, from the baseline, density improved elastin by 82% over the baseline. And compared to monopolar treatment, you can see the density improved 242%. This is a calculation that you can calculate from the graph. You can see that with mono and bipolar, you have improvement 82%, while the monopolar improve only 24%. When you compare the difference, you can see that about 240% improvement, or 2.42 times improvement for mono-bi and compared to monopolar. Another study that you can observe the improvement of newly synthesized collagens improve compared to the baseline about 240%. And when you compare density to monopolar IF alone, you can see that the newly synthesized collagen improve more than 5 times or 500%. This is a calculation that you can see here. And with another calculation is the mature collagens. You can see that with mono and bipolar is improved 159% compared to baseline. And monopolar alone improve only 59%. So overall, the density is better than monopolar alone, at least 169%. From the study from this paper, we come to look at the clinical outcome. Some of the colleagues in different countries give the photo here. You can see that after 6 weeks of the treatment, you have a nice contour of the face, especially on the jaws and the lower face. You can apply this on the eye with the eye tips. You see immediate improvement after you can have widening of the upper eyelid. And improvement of jowls in younger patients as well. 6 weeks after, you can see the difference of the nasolabial fold. This is from Korean study, and you can see improvement of jowls. Again, with high tip, which is mono plus bipolar, with level 4 of the treatment and cooling at level 5, you get nice improvement of the nasolabial fold and wrinkle around the eye also. This is 6 weeks after you seen reduction of wrinkle around the eye by combination of this radio frequency. Then come to look at our Thai experience that we apply, but we use different setting from Korean setting. We use lower number of the shot and increase the temperature level of treatment to number 5 compared to most of the study that done in Korean that use 2.5. You can see at 1 month, patient have a slimmer face, sharper chin and jowls, and improve of nasolabial folds. And 3 months, he still have improvement going on at the jowls and angle of the mandibular area. With Antra 3Ds, you see reductions of the nasolabial fold and improvement of the marionette line as well from the 3D antella. This is another patient who have, you can see the lift up of the jowls, and also the nasolabial fold seems to fill up nicely. And 3 months later, you can see it's lift up more and have nice nasolabial line reduced. With Antra 3D also demonstrate nice reductions of or depression volume at different level deep and medium and shallow. This is marionette line measurements. You can see the reduction is quite prominent. This more chubby face at 1 month. We just follow him. With measurements, you can see it's quite dramatic. And this is a patient that you can see that on the submental area, it has been lifted up. But actually, we not treat that area. We treat all the picture from Thai study. We treat only on the cheek area. We not treat the submental area. But you can notice that the submental has been lifted up also. Older patients, 70 years old, you can see the nasolabial fold lift up, and the marionette line has been improved, including nasolabial fold. It's getting better. You can see that the nasolabial line is different now. Another young patients who have better at 1 month. This patient also improved nasolabial line and lift up. Most of nasolabial line has been filled up, look like filled up at 3 months. This will be the benefit of the long term of monopolar and immediate effect at 1 month from bipolar together. So you have fast result, and this is the patients who you see the 1 month you have pointed chin and also smaller facial contour. This patient, although she gained weight 3 kilograms, you can see the contour of the face is different over times. And these patients at 1 month, you can see the chin has a sharp pinpoint and it's getting better and smaller at 3 months' time. So this is the effect of the density. And this patient have symmetrical face. We treat her and she has more symmetrical face. Slimmer face after 3 months' time. Again, you see the submental. The submental has been lifted up also, even we treat only on the cheek. And it also have a symmetrical face. We treat only one side. On the right side of the patients, you can see she has better contour now. So density is the world's first patent sequential heating technology. It's combined unique both monopolar and bipolar in one shot. In one treatment with no downtime, you have immediate improvement with long-lasting result, and it's clinical proven that it's improved skin qualities. This is a combination of the improvement that you can see improve all the elastin collagens, newly synthesized collagens, and mature collagens in animal models. And density is better for pain control during the treatment compared to conventional. Patient can be treated comfortably with more result. With the higher energy, you can give volumetric heating and you can get the immediate result from combination of bi and monopolar. Thank you very much. Now let us welcome next speaker, Dr. Chang Lee Lin, who will be presenting on maximizing the clinical outcome of HIFU based on his extensive clinical experience.
Okay, good morning. In this presentation, I'm going to talk about HIFU. Radio frequency and HIFU are the most two important technology in our daily basis. I didn't do much HIFU and radio frequency before I used density and linear Z, or because it was too time consuming and painful until I began to use linear Z and density. So I'm going to share my experience of using the devices to tackle different clinical indication. I'm a dermatologist based in Taipei. As we know that when we age, we lose volumes and tissue in different layers. So in the epidermis and dermis, we lose collagen and we lose the integrity of extracellular matrix. For the deeper area, we lose volume, so we lose the definition and the support. So when we are using HIFU or RF to to treat the aging signs, we need to think about what are the layers we are targeting. So as we know that we have, we can divide our tissues roughly in two main parts. One is the area above mass, the other is the area below mass. So the area below mass is more associated with facial definition, facial projections, which loses volumes in the aging process. But for the area above the mass, it's more associated with facial fullness. It's only associated with body weight change, and some areas even increase with age. So that is the time that HIFU may come into use, may be helpful. So for different layers of skin, we have different options. For superficial area, if we have pigments, we can use picosecond lasers, or we can use fractional laser to tackle the skin texture. Then for RF and HIFU, we can do this skin tightening. And for areas for the superficial fat and area that's mass, we have HIFU and radio frequency. For deeper areas, we usually do injection to combine and to make the result more holistic. So for the superficial part of the skin, we have different options of energy-based devices. So it depends on the source of energies that we are using. We have RF, we have ultrasound, but we also need to consider the time, the indications, and of course, very practically, the consumable cost, the downtime, pain level, and the result the patient can get. So HIFU in early days, they have good results. As we know that the idea is to deliver the HIFU in different depths of the skin to do precise tissue heating, and then we want the end results to be a tightening of the skin. And the idea is to increase the tissue temperature up to 60 to 70 degrees, and then there will be collagen stimulations and collagen contracture. It's classic, but the indications was also a bit less than what we're using now because of the limitations of the cartridges and the way we deliver the energy. And most important of all, it's time consuming, and sometimes it can be painful for most of patients. So most of the patients, their feedback is that in the past, when asked what kind of treatments is the most painful one in their experience, most of them will answer HIFU. So, but it begins to be very different when I started using the predecessors of Linear Z, which is Ultracell Q+. As we know that previously we used HIFU to increase the temperature up to 65 degrees for collagen contraction, and for some of the body contouring devices, we want the temperature to be around 58 degrees to do fat reduction. So the temperature is a key to control the result what we want. For Q+, before Linear Z, there are two different kinds of cartridge. For the dot pattern, it does local heating with higher intensity at focal points, higher temperature at focal points, so that we can do facial tightening and restore the facial definition. And for the linear pattern, we do bulk heating. It's approximately 5.5 times wider energy delivery area and also 36% higher power. So we use it to do fat reduction for the lower face and even for the body area. So the idea is that for areas that we want to do bulk heating, we use the linear pattern to do fat melting, volume reduction, and the contouring result is actually quite amazing. And then for the area we want to have lifting and tightening, we do local heating, and then we expect to have collagen denaturation and neocollagenesis. So the main point is that the treatment time is very short. For the older generation, for 300 shots, the dot pattern takes only 8 minutes to finish 300 shots, and linear pattern 3 minutes, so it is very efficient. So you can combine both patterns in a phase depending on the status of the patient and your treatment goal, which is very important because you get to do customized individualized treatments for different individuals. So, and there are also nice publication support that tells us that when we do HIFU to do fat reduction, we not only destroy the fat, we actually also induces a cascade of the changes in the tissue. First, we reduce the fat. So the fat thickness is decreased after the treatment. And then there comes with a P53 activation, which is beneficial, favorable for apoptosis and autophagy induction. And so there, after the treatment, there will also be apoptosis after the treatment, and then we get less fat cells after treatment. So depending on the layers we want to target, so we use different patterns and different depths of the cartridge for the treatment plan. And then for different individuals, of course, the patient is expected to have some subcutaneous fat, some fat descent, and they usually can benefit from skin tightening. So for different individuals, there are different protocols. Like I said, for the superficial fat, it descends in the aging process. So for superficial nasolabial fold and also the jowling fat, we can use linear pattern to reduce the heaviness of the superficial soft tissue, and then we get to restore the facial proportion and contour, and then we can do skin tightening to improve the overall skin tightness. And for even heavier face, we can use different depths of the linear pattern to target the cheek, lower cheek, jaw area, and even the submental area. So it is very flexible, and you can do very individualized treatment plan for different individuals. So this is one of the cases that she actually has a facial asymmetry. We cannot change the bony skeletal support, but we can modify the facial proportion by using similar idea. For example, on her left face, she has weaker zygomatic support and maxillary support, which gives her a secondary fat displacement more obvious, especially more obvious on the left side. So what I did for her is for the left side, I use a total of 500 shots with linear pattern 340 and the dot 160. And the other side, I use a bit less, 400 shots, linear 260 and dot 140. And then I treat them accordingly. So this is the result 3 months after 900 lines. We can see the face is more symmetrical and the left side is less heavier, so that gives her a slimmer lower face and the more symmetrical facial proportion. And this is the oblique view. This is the other oblique view. Especially we can see the heavier side is much better after the treatment. So all the way month by month, we can see some gradual improvement, and by the time at month 3, the result is much better than the baseline. So for the older case, we can also have different treatment plan. For the upper face, we can tackle the moderate skin laxity and temporal hooding that gives her a little bit ptosis of the eyelid and the brow. And then for the mid-face to the lower face, we can use the linear pattern to treat the displacement of superficial nasolabial fat pads and superior and inferior jaw fat pads. And then submental area is the same. So for her, I did 1,200 shots, and then for different areas, I have different combination. So this is the result 3 months after 900 lines. We can see the definition in the lower face is much better and slimmer, and we can see the nice brow lifting effect after the treatment. And from the frontal view, it looks younger and a bit more eye-opening after the treatment. And then the lower face looks heavier. Submental areas looks fine after the treatment. So with Q Plus already so excellent, but we want it to be better. So JC's now has this linear Z on the next generation, so it can make the whole treatment even more convenient and make the whole treatment even more efficient, because the linear patterns, it delivers in a different way, it goes back and forth, so that makes the whole treatment time much shorter. With 300 shots, it takes only 1.8 minutes. There is more we can do with this HIFU. We can not only just do the fat reduction, we can do contouring, we can do tightening, and even we can do fat regeneration. So according to the protocol, which are backed up by the publications, for the energy levels a bit higher, not surprised we can do fat reduction, and then for the dermal area, the moderate level of energy, we can do tightening. And for we can also target the dermal area with moderate energy level to induce the collagen and elastin fiber proliferation, and to enhance the skin tightening and to treat the skin elasticity. And most importantly, if we want to have some face hollows, we can use a bit lower energy levels to do fat proliferations. Here are some data that shows the results and the proof. So here in these studies, it shows that with linear patterns, it can heat up the dermal layers at the energy level at about 0.5 joule. So it reduces the marker of aging and senescence, which is CAV1. And it also promotes fibroblast activation and rejuvenations in both cell and animal models, because it restores the ERK1/2 signaling. So in vivo applications, it shows that it breaks the CAV1, MD, M2, SIRT1 complexes. So it reduces P53 activations, which allows fibroblasts to exit, growth, arrest, and begin to repair, begin to grow. So this is one of the molecularly significant proof that shows when we have the proper energy level, we can increase the collagen and elastin fiber synthesis. And it also shows that by doing it this way, it improves extracellular matrix remodeling and the collagen and elastin regeneration. So it reverses the collagen and elastin loss. So it supports the extracellular matrix remodeling. So this is what we can do by delivering the energy into the dermal layers with moderate energy level with a linear pattern. And then it decreases the collagen or elastin breakdown. Because of the drop of the MMP1, and it increased TIMP1. So it all shows that it's a different way of doing using HIFU, and then improve the skin elasticity. And also in the animal models, what we can do with linear Z is that we can use it to do fat proliferation. In this study, it shows that with the energy level at lower energy level, around 0.2 joule, it increases the fat proliferation. So it shows that in this study, lower energy HIFU at 0.2 joule, it can induce adipogenesis in subcutaneous white adipose tissue, because it modulates cilia of the adipose-derived stem cells, and potentially it contributes to the skin rejuvenation. And so when we do delivery in a relatively lower energy level, we heats the subcutaneous tissue up to around 40 degrees. So it upregulates the HR protein 70, which suppresses inflammation, and then in turn it restores the cilia function in adipocyte cells. So it initiates the cascade of fat proliferation. So it's what we can expect is quite different than what we do with higher temperature by delivering the energy with HIFU. So this is a quick summary of the different temperature and energy levels that we can expect for the tissue reaction. So with all this knowledge, what we can do is we can do fat proliferations for the more hollowing areas, and then for areas that has relatively more volume, we do fat decrease and skin tightening. So this is some of the examples treated by Korean doctors, shows that especially you can see the apple cheek, the cheek areas, it looks plump, while the areas, the contour is very smooth and skin quality also improves very nicely. So with Linear Z, it combines the linear patterns and the dotted patterns just in one cartridge. So it's very easy to use. You just need to choose from the panel to choose the dot pattern and the linear pattern to choose from the depths that you want to target in your skin, and then you can begin your treatment. So it makes the whole treatment very quick and very efficient. So it makes the whole treatment 300 shots. It takes only 1.5 minutes, and then it's done. So usually the patient is happy, a doctor is happy without having to sitting there for so long. So these are some of the examples. In the examples I do, this is the energy levels I did for the mid-face and the submental area. And then 4 weeks after 900 lines, we can see the nice improvement of our lower face contour, and especially the submental area. And this is the other view that we can see the lower face becomes slimmer. The chin shape becomes much better due to the fat reduction effects of the submental area. This is the result 3 months after. So we can see gradual improvement until 3 months after the treatment. So it's makes sense, because usually when we do fat reduction, it takes time for the fat to be removed by our immune cell, and then of course skin tightening, it takes some time to reach its maximum. And for submental area, I observed the results from the 3D camera. We can see there is significant volume loss after one session treatment. And this is another case that we can see submental fat, and then for a lot heavier in the lower facial area. So this is the result 2 months after the treatment, slimmer lower face, a nice facial proportion, and we can see a nice definition after the treatment. This is another case that also has heavier lower face, from mid to lower face. So I cover the mid face facial area and the lower facial area with both dotted pattern and linear pattern. Especially for the linear patterns, I target the nasolabial fold and the jowling. So it's pretty much like this. So this is 3 months after treatment. We can see the submental area is much improved, and the whole facial proportion is much better, especially the lower face is slimmer. This is particularly obvious from the frontal view. And this is the lady that she wanted to remove the submental fat and has a better submental, the facial definition, but she also had limited budget. So I recommend her to begin with 300 lines. So this is the result 6 months after the 300 lines. So the result is already very good. So she was quite pleased. So this is the oblique view. And for younger people, we can do more skin tightening, and then especially for men, we can give them more facial definitions. So this is a result for the total facial tightening with the more dotted pattern. And then from a 3D camera, we can see the lifting effects compared with the baseline. And also some of the areas, it's more tightened, so there is some volume reduction. And you can also combine with microneedling RF. This is one of the examples that I deliver the energy to the heavier lower face, and then for the upper face and mid face and then skin texture improvement, I use microneedling RF. So this is the result 3 months after just one session. And you can also combine it with picosecond lasers. For lasers, you improve the skin texture and remove the pigmented lesions. And then for the rest of the area, restore the facial proportion and improve the facial definition. So we can see not just the skin tightening, but also the skin texture, and also the skin, the pores and wrinkles are much better than baseline. And or for areas that needs more volume, needs more support, you can combine with the fillers. So you restore the facial definition and also changes the facial proportion and restore the facial projections. And then this is one of the cases that I use 600 lines for the body fat, for body contouring. So you can see 4 weeks after 600 lines on one side, you can already see very nice reduction of the fat in the treated area. So in summary, the linear cartridge and the cartridge itself can effectively improve the heaviness and the lower face, especially the lower face through the fat reduction. And then we can use it for different body areas. And you can combine linear Z or other devices to do different treatment plan. And even with the linear Z alone, you can have very individualized treatment plan for different individuals, and even for the same individuals, every time the treatment plan can be different. So thank you for your attention.
Thanks, Dr. Lin, for comprehensive lectures. Let us now welcome next speaker, Dr. Nishikawa, who will be presenting on synergistic effect of HIFU and monopolar bipolar radiofrequency, hand-on workshop for aesthetic practitioners.
Okay, so hello everyone. Thank you very much for joining this session. I'm so excited to share our experiences of the combination therapy of HIFU and RF technologies. She is 48 years old. She is already looks very young, but we assessed her condition and asked about her main concerns before the procedure. Let me show you the procedure video. She is mainly concerned about the volume along the jawline, as well as the nasolabial fold and sagging of the eyelids. To deal with these concerns, I performed a combination treatment using HIFU and RF. I planned to enhance facial contours and provide overall skin tightening. When I asked about areas where she doesn't want any volume reduced, she pointed out depressions in the temporal area and under the zygomatic arch. Those areas were marked white. First, we start with HIFU. Using a linear, we target subcutaneous fat along the jawline to reduce volume. Then, we switch to dot setting and treat the full face and neck at 4.5, 3.0, and 2.0 millimeter depth. After that, we move on to RF. We use monopolar and mono-bipolar RF to tighten the cheeks and eyelid areas and to improve skin texture. These orange lines are the markings for ultracell Z. I marked the orbital cavity, mid-papillary line, nasolabial fold, and thyroid areas. We try to keep the markings simple so that even beginner practitioners can follow them easily. Also, the white marker indicates areas we don't want to reduce volume. In Japan, more patients are worried that hive may cause cheek hollowing. To avoid volume loss, we skip linear shots in those areas and reduce 3.0 millimeter dot shots as well. I am explaining 3.0 millimeter dot design. This patient expressed concern about volume loss in the temporal and subzygomatic regions. So we intentionally reduced the density of 3.0 millimeter dot in those areas to minimize the risk of further hollowing. We start with 4.5 millimeter linear shots. This is the actual shot speed, no edits. It's hard to believe, but the device really fires this quickly. Using the 4.5 millimeter linear mode with the core cartridge to reduce fat volume, a total of 90 shots per one side were applied to the face, jawline, and submental area. So after that, using the same cartridge and switching to the 4.5 millimeter dot mode targeting the smooth layer, a total of 120 shots were applied to the cheek and submental area. To minimize the risk of nerve injury, we avoid delivering energy to the inner cheek area. We also do not use anesthesia. This allows us to closely monitor the patient's responses. If they report unusually strong pain or show any signs of motor dysfunction, we can immediately stop the procedure. There is some debate about whether the SMAS truly exists as a distinct anatomical layer. Regardless, we keep in mind the presence of retaining ligament along the lateral cheek. So our treatment focuses mainly on the outer face. When treating in the spine position, I find it easier to visualize a natural lifting effect, almost as if we're fixing the hairline area in an elevated position. In the submandibular region, we avoid irradiation near the lower part of the ear to prevent potential damage to the anterior branch of the great auricular nerve, which run superficially in that area. And using the same cartilage and switching to the 3.0 millimeter dot, targeting the dermis, a total of 240 shots were applied to the cheek, submental area, temple, forehead, and neck. As I mentioned earlier, in areas where we want to preserve volume, we are careful not to space the shots too closely or stack them too much in this depth. We also perform neck treatment using the 3.0 millimeter dot. It's recommended to avoid the thyroid area when delivering energy in this region. And switching to the 2.0 millimeter dot, targeting the dermis, a total of 450 shots were applied to the face, submental area, and neck. In this setting, because the risk of nerve injury was low, we also treated the inner cheek, forehead, philtrum, and chin area. Next, I'm going to talk about density. We treated the entire cheek and submental area, but I marked the problem areas, including the jaw fat, malar fat, and submental area. At treatment level 2, using the monopolar tip, a total of 200 shots were applied to the face. I applied the oil first, then treated with a stamping technique. After checking for any pain, I increased the level by 0.5 increments up to level 3. I held the fat with my opposite hand while performing the treatment. I imagine where the fat used to sit before sagging, and I target the area with the idea of repositioning it and holding it in place. I performed overlapping shots on the problem areas. Because this is a focused stacking over a small problem, it can be more sensitive to pain. To manage that, we lowered the treatment level. In this patient, she is so sensitive to pain, so I had the procedure at the level 2.5 for the problem area. Next, I applied 100 shots to the face using the mono by tip called high tip, starting at level 2. I used the stamping technique. We checked the patient's pain tolerance and gradually increased the energy level up to 3.0. The treatment was performed at level 3.0. From this point, the video is shown at double speed. Each shot delivers 4 pulses of monopolar RF and 1 pulse of bipolar RF. This combination is expected to provide immediate tightening effects and improve skin texture. This is the second pulse of the treatment. If you remember which areas the patient found painful during the first pass, you can lower the level by 1 step for those spots during the second pass. It's a simple tips that really helps improve patient comfort and satisfaction. At our facility, we currently use only the stamping technique. I've heard that some clinics use the moving technique, but we prefer stamping as it allows for more precise energy delivery and deeper thermal penetration. And with that, the treatment for the cheek and submental area is complete. Now, let's move on to the periocular area. I applied anesthetic eye drops, oxybuprocaine. I placed the ocular shield. If If you ask the patient to look down toward their belly button during the process, it's easier to place the eye shield smoothly. Starting at level 0.5, a total of 450 shots were applied to the upper and lower eyelids using the monopolar tip and high tip. After checking for any pain, I increased the level by 0.5 increments. On the inner corner of the eye, the treatment was performed at level 0.5. We've had a few cases of burns reported during eyelid treatment in our group. All of them occurred on the inner part of the eyelid area. So for now, we lower the energy level when treating that region. To target both eyelid laxity and fine lines, we combine monopolar RF with the mono-bipolar eye tip. Given our prior experience with Thermage, where we performed eyelid treatments using ocular shield, we chose to adopt a similar approach in response to stronger requests from patients familiar with that modality. One of the key advantages of the density system is that its high eye tip allows the selection between monopolar and bipolar. We can offer greater flexibility and individualization in periocular treatment protocols. The treatment is now complete. There's some mild redness immediately after the procedure, but it ended without any significant skin issues. In this case, we used depth settings that are also available with the previous model, the Ultracell Q+. So I believe this can serve as a reference for those of you who are still using the previous model. Ultracell Z offers finer depth control and greater efficiency. For density, we used the two types of cartilage tips marked in the red here. This is the treatment area for the 4.5 millimeter linear cartridge. We have only used the linear for fat reduction so far. Here is the coverage of 4.5 millimeter dot, 3.0 millimeter dot, and finally 2.0 millimeter dot. And we treated the cheek and cemental area with density. We also treated the periocular area. Here are the before and immediately after photos. You can see tightening along the jawline, which was the patient's main concern. Additionally, the cheek top appears lifted, and importantly, the areas where she didn't want volume loss seem preserved. From this angle, the tightening effect is especially noticeable. Unfortunately, the treatment was performed just a few days ago, so we don't have long-term follow-up yet. So, next I'd like to show you several combination cases with longer follow-up. In this case, the patient received both linear height and density. At 2 months post-procedure, we can see overall facial tightening compared to baseline. In particular, the segmental area shows a visible reduction in volume. Looking at the volumetric changes, there is a general reduction overall, with the most noticeable decrease under the chin. This female also received both linear height and density. Her face was already slim to begin with, but she was concerned about the jawline. As you can see, her jawline gradually became more defined. Volume reduction is visible in both cheek and the chin, under the chin. This is a female in her 50s treated with dot height and density. Immediately after treatment, the face looked firmer and the effect was still visible at 2 months. In the eyelid area, there was a reduction in fine lines and improved skin texture. Volume analysis shows slight reduction in the jaw and malar fat pad. Conversely, there is a subtle volume increase in the hollow area of the mid-cheek, suggesting a lifting effect. This case is similar to the video earlier. I will skip this case because the time is limited, sorry. This is similar to the video earlier. Density was combined with both linear and dot height. You can see that fine lines around the eyes were reduced and the skin looks firmer. At around 2 months post-treatment, the malar fat area appears visibly more lifted and tightening. In summary, combining RF and HIFE allows for layered treatment. Devices have become more advanced with more settings and functions. So results still depend on how we use them. It's important to understand the device and use it properly to get the best outcomes. Thank you very much for your attention.
Thanks, Dr. Nishigawa, for a wonderful talk. Now we have completed all 3 sessions, and we will proceed to Q&A sessions. Do we have any questions from audience?
Thank you for nice presentations. I'm Dr. Nora from Tokyo. I have a question for Dr. Nishikawa. So you mentioned that the power 3 is usually enough, both in terms of density, for like a tightening, both for the monobi and monopolar tip. So do you see sometimes a higher level can achieve a better result? Or like a power 3 or 2.5 is usually almost enough for all the cases? Or do you have any kind of suggestion?
Thank you for a good question. Thank you. So yeah, I belong to the very unique model of clinics. I belong to the biggest chain of clinics, so we need to standardize the protocol. So, and of course, we need to be careful in the safety. So in our group, first, we do not recommend to use anesthesia. So some patients are complaining of the pain during the procedure. So for that case, I cannot increase or elevate the level of the procedure. And moreover, we choose the cooling level only 2 or 3 because we can choose 4 or 5 cooling setting, but in that cooling setting, I think the superficial thermal effect is lower than the lower setting of cooling. So I think. So in our protocol, for the cooling is only 2 or 3. So, and we need to see the patient's pain. So some patients cannot elevate the level. But in my opinion, in my practice, as you mentioned, the level of RF devices is so important. So I think Dr. Wichai's presentation, his level is 4 or I
Five-
think higher,
five.
higher
Yes.
than our case. So yeah, if possible, I need to increase the level, but yeah, for this case, it is difficult.
I think for density, the cooling system, normally I use level 2, and I think the pain level of the high tip from density is quite low compared to conventional monopolar RF. So I'm quite happy that with the pain level that with monopolar and bipolar together, we can reduce the pain level quite down a lot. Anybody have questions? Professor Go? Oh,
Hi, nice to meet you. I have two questions. One is about density tip. They have two kinds of tips. One is monopolar, another is monopolar plus bipolar. I want to know your experience about effectiveness and safety, both of them, versus. And second is about linear G. So HIFU, concept of HIFU is coagulation of the dermis. So we need over coagulation is not good to the dermis. So below the 30% of coagulation is ideal to revive the skin. So in case of linear coagulation, is it good or bad in the future? I want to know your opinion.
first, Dr. Nishikawa talk about density questions.
Yeah, thank you very much for asking. For density, in mono by tip, called high tip, we can see immediately results, see the immediate results. So it's a good point. But in terms of the volume tightening, I think monopolar tip is better, in my opinion, in my practice. And in terms of the safety, in our group, even if we are using mono by tip, we don't see any burns or complications, severe complications so far. So how about Dr.
In
Rich?
my opinion, the monopolar tip, classic tip, it's rather painful, similar to all the conventional monopolar. So I'm the big fan of the high tip, which is a combination of the two RF, but I use a rather high energy level. So I can see that the tightening from high tip, most of my patients appreciate more than the monopolar alone. So I use only the high tip alone normally. But one good thing about the high tip is if you look at the tip, you can add some directional treatment also. I normally treat by look at the cartridge, you can see the bipolar line as a cartridge.
Yeah.
I will do crisscross every time to get benefit from the directional treatment. So the next question will be for Dr. Lin about the linear Z.
Okay, before answering the question of linear Z, I have something to add from my personal experience about density. Because in Taiwan, we have only high tip, so we have no option. So far, I use only a high tip. And the average, my average energy level is quite similar to Dr. Wichai. It ranges from 5. My highest energy level is from this week and 1 month ago, 7.5. Usually for patients that have thicker subcutaneous fat. And so because usually I begin from around 4 to 5, and then I check with the patient's comfort level. And both of the two patients that I go up to 7.5, they say it's not painful at all, so I increase a bit, and I can see both of them have thicker subcutaneous fat, so they can benefit from the more of the contouring effects by higher energy level. And one of the patients says that when I go to 7.5, I asked her, is it really not painful? What are you feeling now? She said, oh, you are pressing my face with an ice cube. So, very comfortable. Yeah, so I think for patients with thicker subcutaneous fat, they can benefit from a higher energy level with density. And as for linear Z,
but a higher energy of the high T, sometimes it make a very small vesicles side effect.
you mean
They make small vesicles. It's small burn. In the high
for
level of age.
submental area, usually we may need to lower the energy level. But for cheeks, usually in general, it's quite safe.
Right.
Yeah. And
I agree with you. I also go up to 7 or so. That one in my slide normally for study. But I agree that it's very safe for me also for the high tip, especially in the thick area. Yes.
Yes. And for the linear Z, usually from a publication, it says that if we want to target the dermal layers to have more coagulations, the ideal energy level is below 0.5. So usually the energy level is not too high. Yeah. So, but for me, I normally do less 2 millimeters. I do more 3 millimeters and 4.5 millimeters. But I use different energy levels for different facial area just to make sure that I have both skin tightening and also fat reduction.
Okay. Thank you so much.
Thank you, Professor Oh. I would like to ask Dr. Nishikawa about, you use both density and linear Z together. Do you apply radiofrequency first or radiofrequency later?
I think that's a good question because in my clinic, I need to consider the efficiency of reservation, actually. So I want to separate the HIFE reservation and RF reservation. So if the patient combine HIFE treatment, linear and dot and density, in our clinic, first HIFE and density, but it's not from the medical side. It is the clinic efficiency. Yeah. But I think if the combined linear Z, not dot, linear Z for fat reduction and density, I can choose density first and the linear Z, but yeah, it depends on the cases.
In my practice, I normally apply radiofrequency first in my clinics to heat up the temperature in the tissues to certain level. As we know that the fat melt threshold is about 58 centigrade, as Dr. Lee said. And then when we apply the linear Z later on, I can lower energy and make patient feel more comfortable, and we can efficiently lyse fat without doing too high linear Z energies.
Yes, I agree with that. And also there is a publications, also I think that's one of the publications with JC's device in it back in 2019. It has animal studies that trying to compare the results by using radio frequency or microneedling RF first followed by HIFU, or HIFU first followed by radio frequency or microneedling RF. And the conclusion shows that if you do RF first and you want to have a bit more skin tightening effect, usually HIFU first seems better in that animal study because according to the observation, and I believe the observation is from the cadaver skin, it says that if you do radio frequency first, it may causes a bit more coagulation in the dermis, and then that can limit the transmission of HIFU due to the previous coagulation, and then the energy transmission may be a bit reduced, compromised, if you want to have more skin tightening effect. But for the fat reduction point of view, I agree with that. Yeah.
Anybody have more questions?
I'm Dr. Beatrix. I would like to ask Dr. Wichai about density. What do you think, is there a high risk if we are doing it in melasma patients for density, because there's a lot of heat in that area? Will it recur the melasma incidence in the skin?
Well, I think you can treat in melasma areas and without any problem. The heat is not the problem because we can restore some of the, because melasma is one of the, now they regard as an aging process also. And there's some of the research about bipolar in the past that bipolar can help melasma tissue as well. So I think it's very safe to treat on melasma area. Okay, I would like to thank all speakers and audience for today, and we would like to close the sessions now. Thank you very much. Thank you.